Raynauds phenomenon is a condition which decreases blood flow to the fingers. It can also cause reduced blood flow to other extremities such as toes, ears, nose, nipples, and knees. The reason this happens is due to vasoconstriction and spasms of blood vessels in these areas, meaning the blood vessels get narrow and therefore reduce the blood flow to these regions. In Raynauds phenomenon, these spasms happen in response to cold, stress, and emotional upset. Here is an appearance of Raynauds phenomenon in action affecting the fingers. First you can see this very pale appearance of the fingertips, it then transitions into blueness and then this red appearance of the fingers. Primary Raynauds disease can occur on its own without any other underlying medical conditions. However, if Raynauds phenomenon is occurring due to another disease, which is possible, it's known as secondary Raynauds. The main diseases which are associated with Raynauds phenomenon include lupus erythematosus, scleroderma, Crest syndrome, rheumatoid arthritis, Sjogren's syndrome, polymyositis, and blood disorders like cryoglobulinemia. The mechanism of how it happens is the body or extremities are exposed to the trigger factors, most commonly being cold weather. There is spasm of the small arteries at the fingers and toes. These regions become pale due to reduced blood flow here and low oxygen supply. The affected areas then often can turn blue in color due to lack of oxygen and tissue hypoxia. After warming up the region, the arteries dilate, which increases blood flow and there is increased oxygen supply. The colour of the extremities then change to a red colour, and here we usually have warmness at the extremities and throbbing pain. There also may be some slight swelling. Usually when this process happens, it's usually bilateral, meaning it happens on both the left and right hand side of your body at the same time. Raynauds phenomenon is more common in women than men at a ratio of 5:1, and often it occurs between ages of 16 to 40. It more frequently occurs during periods of cold weather. The complications of Raynauds could be serious as it may lead to gangrene and amputation, but this is extremely rare unless the exposure is severe and prolonged, or if there are other medical conditions you have where there is blockage of your arteries. To diagnose Raynauds, physical examinations of the extremities are conducted, along with ANA tests to test for any autoimmune disorders. Thermography and arteriography are imaging studies which could be undertaken. Here is a thermography report showing heat signatures of a healthy hand at the bottom and Raynauds hand at the top. The red areas indicate warm areas while the green area shows cool areas. You can see in the Raynauds hand, the fingers are green in colour, indicating reduced blood flow, as less heat is being emitted from these areas. The initial management of Raynauds is to teach the patient to avoid certain stimuli, like cold temperatures, as it provokes vasoconstriction at the extremities. Tobacco is also a stimuli for Raynauds, as it also causes vasoconstriction at the extremities. So avoiding cold temperatures and wearing layers of clothing, especially gloves when going outside, is important. Avoiding smoking will also help. Patients should also be warned to avoid trauma to the extremities, which may occur due to numbness at the fingers when an attack is happening, so sharp objects should be avoided. As Raynauds causes throbbing pain, painkillers are advised. In terms of medication, calcium channel blockers like nifedipine and amlodipine can be effective in relieving symptoms. A procedure known as a sympathectomy could also be undertaken, which interrupts the sympathetic nerves by removing the sympathetic nerve ganglia to reduce incidences of blood vessel spasms. Also, some medications like amphetamines and certain cancer drugs should be avoided as they can cause narrowing of the blood vessels, which may promote symptoms of Raynauds phenomenon.